My name's Ewen McPhee. I'm the Sentinel GP or Practice Principal for Emerald Medical Group. I'm also a Senior Fellow for Generalist Medical Training and at the moment the President of the Rural Doctors Association of Australia. Well, I've been a long-term resident of Emerald. I've been a GP here since '92, and prior to that I was the Medical Superintendent of the local hospital. I've been a GP obstetrician all that time, and I've had the absolute pleasure of delivering babies on babies in Emerald, so I've very much grown up with this town. Certainly when I came to Emerald I was the only doctor at the hospital, and we had 200 deliveries a year. I relied very strongly on the local GPs who all also had anaesthetics and obstetrics, and we tended to tag team each other with looking after our own patients. So the training I had back in those days was done in a major tertiary hospital. In my first couple of years out I went to Charleville, and I had the absolute pleasure of working with a surgeon called Lewis Ariotti, who was there for many years, and he taught me much about surgery and about advanced obstetrics and procedures, and I was able to do a lot of anaesthetics with the local surgeon at that time. So it was a fantastic training for rural practice. Look, I think the key thing is somebody who really enjoys country life, somebody who's resilient, who enjoys a challenge, but really more and more these days enjoys working with other people and being supported in a team. Good country practice these days involves working with your peers to provide really quality care for your patients. When you enter into the Australian General Practice Training Program, it's really important that you work with your training advisors around choosing the pathway for you, and if you really want to be a GP obstetrician, very early in your early clinical years, identifying that and seeking a placement where you can do your GP obstetric qualification, either the advanced one, which is 6 or 12 months. Now, essentially, ACRM requires that you do an advanced skills training post of 12 months as part of your 4-year training program. And General Practice Obstetrics, GP Obstetrics, is an excellent advanced skills training post to do in that place. The College of GPs recognises that advanced skills training as part of their Fellowship of Advanced Rural General Practice, which is an extra year onto your normal GP training. The advanced skills training post itself takes 12 months. Now, what I'm talking about there is the ability to do operative obstetrics, so caesarean section particularly, takes the 12 months. There is a 6 months women's health type qualification, which doesn't allow you to do the advanced surgical obstetrics. Look, the DRANSCOG is assessed by the College of Obstetricians, and it obviously involves examinations and OSCEs to assess your clinical skills and your knowledge. I think the key thing is to identify your interest through the generalist medical training, to work with your local hospital to achieve a post, and apply through the College of Obstetricians to be recognised as in a training position. Certainly when I went through, it was a very busy job, it was a very exciting job, and I learnt a tremendous amount in that time. Honestly, when you apply yourself and you work hard, the assessment is just assessing all the stuff that you've learnt during that time. So I never thought it was a heavy load. Certainly if you really concentrate on learning throughout your rotation, the assessment is very reasonable. There's a recognition of the importance of rural obstetrics, of trying to reopen birthing units right across the country, and to allow women to have their babies as close to home as possible. So the opportunities for GP obstetricians to provide care to rural women are expanding. Certainly in Queensland, as we've reopened birthing units right across the country, we've seen a greater need for GP obstetricians to come into those communities and provide those services. What I've found is that most people do need to be very conscious that they have to have an arrangement with a major hospital, so often the training hospital in which they did their advanced skills, perhaps go back every 1 or 2 years and do a week here and there. The College of Obstetricians and a lot of clinical credentialing committees now require that you demonstrate that you've kept up to date with your fetal surveillance program, and the College of Obstetricians particularly offers a yearly upskilling program as well. So there's plenty of opportunities to keep your skills, and what I've found is really important is you keep your relationships with your regional hospitals. What a registrar would expect from training to be a GP obstetrician is that they would learn how to, first of all, know their limitations. I think it's very important that when we embark upon these training programs, we recognise that we're being trained to a specific scope of clinical practice. Now, what I mean by that is you need to be able to certainly manage normal labour very well. You need to understand when things are going wrong, and you need to be able to manage a caesarean section or a forceps or a ventouse delivery, and perineal repair. So these are the common things that we need to be able to manage. One of the key roles for a GP obstetrician, particularly in a resource-poor area, is recognising when an emergency is going to happen, being able to mitigate or predict responses early so that you can bring those extra resources in, or for example with preeclampsia, if you identify it, being able to appropriately transfer a patient in a safe way. So GP obstetrician is about knowing what you can do in the context of your practice, knowing what the strengths of your local obstetric unit are, and what are the areas in which you really need to think about early transfer, or in our context bringing in the flying obstetrician. So knowing your limitations and knowing what your strengths are is a really important part of being a GP obstetrician. When I first came to Emerald back in 1989, I had an opportunity to do obstetrics, I had an opportunity to do anaesthetics, I could do surgery, and I thought, why would I go anywhere else in the world when I can have it all? So I guess for me, it was about being a complete doctor and about providing great services to a rural community. And it's really made a fulfilling career for me as well, because not only do I get to see my patients in my general practice, but I get to be with them during the wonderful time of birth, and also look after the kiddies as they grow up. And as I've said, some of my patients have never had another doctor in their whole life, and I'm delivering the babies of their babies, which is a really unique experience, and I'm really glad I did obstetrics for that reason.